Why does oncology terminology keep changing? Imagine trying to keep up with a language that's constantly evolving. That's exactly what happens in oncology, especially when it comes to understanding reproductive cancers like testicular and cervical cancer. As scientists learn more about how cancer works at the molecular and genetic levels, the words we use to describe these diseases also change. This isn't about confusion. It's about making sure our language reflects the latest, most accurate knowledge. One big reason for these changes is advances in molecular and genetic research. We now know that many cancers are driven by specific genetic mutations and molecular alterations. For example, in testicular and cervical cancers, identifying these changes helps doctors tailor treatments to the individual's tumor. Terms like precision oncology have replaced older phrases like personalized medicine because they better describe how treatments are now designed to target the unique genetic makeup of each tumor. Technologies like next-generation sequencing allow us to see these genetic details clearly, leading to more accurate diagnoses and targeted therapies. Another reason is how our understanding of what cancer really is has deepened. We now see cancer as a process of uncontrolled cell growth that evolves over time. Tumors are not static. They change and adapt, much like living organisms. This understanding influences how we describe tumor behavior, progression, and response to treatment. For example, terms now include concepts like tumor evolution and genetic heterogeneity, which help doctors predict how a cancer might grow or respond. Diagnostic tools and treatments are also constantly improving. New methods like genomic profiling and advanced imaging requiring new words to describe them. As monoclonal antibodies and targeted drugs become part of standard care, the terminology expands to include these innovations. This helps ensure everyone involved in patient care, from doctors to researchers, speaks the same language, making treatment plans clearer and more effective. Standardization is another key factor. Clear, consistent terminology helps health professionals communicate accurately across different regions and studies. When new subtypes of cancers are identified based on molecular features, the language must adapt to describe these differences. This consistency improves diagnosis, research, and ultimately patient care. Finally, clinical guidelines are regularly updated as new evidence emerges. When staging systems change or new treatment protocols are adopted, the language used to describe stages, tumor characteristics, or responses also shifts. This keeps everyone on the same page and ensures that patients receive the most current, evidence-based care. In everyday terms, this means that if someone is diagnosed with testicular or cervical cancer today, they might hear new terms describing their condition or treatment. While this can seem confusing at first, these changes are designed to improve understanding, make treatments more precise, and help doctors find the best ways to fight cancer. It's all about keeping pace with a rapidly advancing field so that patients benefit from the latest knowledge. In summary, oncology terminology keeps changing because our understanding of cancer biology, diagnosis, and treatment is advancing so quickly. The new words and concepts help capture what we learn about how cancers develop and respond to therapies, especially in reproductive cancers. This ongoing evolution ensures that medical communication remains accurate, clear, and helpful, ultimately leading to better outcomes for patients. Always remember to consult healthcare professionals for personalized advice, as each case is unique.